Hello, and thank you for joining us for another episode of Matters of the Heart, a program brought to you by Pentucket Medical Cardiology as well as Haverhill Community Television. My name's Srivastava. I'm a cardiologist here in Haverhill at Pentucket Medical, and I'm joined today once again by my usual co-host and partner, Dr. Seth Bilazarian. And today we're going to talk about something, congestive heart failure, which we've talked about before, but a little different take on it, and talk more about and focus more on how patients can live confidently with congestive heart failure. The phrase in and of itself is pretty awful sounding, and so right off the bat, it has a very negative connotation. And there's been a lot published about this, a lot of guidelines about this, a lot of tips, a lot of advice on how patients can really empower themselves, do well for themselves, and be confident with moving forward and living well with their disease process. So with that, I will hand it over to Dr. Bilazarian and go from there.
Sure. Well, my topic today is really taken from one of our main cardiology journals called Circulation. It's the publication of the American Heart Association. And they have a section called the patient page, cardiology patient page. And they published an article in the last month called A Patient's Guide to Living Confidently with Congestive Heart Failure or Chronic Congestive Heart Failure. So I want to just talk a little bit about this subject. The reason why I'm interested in talking about it is several things, I'll just say. So the number one diagnostic reason why people are admitted to hospitals in the United States is congestive heart failure. So it's a huge problem. Number two, with the efforts to try to rein in costs in our society, of course, the number one diagnosis is a major source of attention by payers, by Medicare and by a variety of people. And specifically, the Medicare payer called CMS has created a real initiative for hospitals to prevent readmission, because as much as 30% of people who have congestive heart failure have to go back to the hospital within 1 month. So some of the background about congestive heart failure. So how do you go from congestive heart failure to living confidently with congestive heart failure? It's not a concept that I was familiar with, this term living confidently. So I thought it was an interesting thing to explore. I'm very interested in Dr. Srivastava's take on this. But as he already alluded to, the term failure is sort of a concerning term. When someone fails at something, it doesn't sound good, and having your heart fail doesn't sound good. It's not a sort of an either or. It's not like you're just fail or not. It's just the heart not doing an optimal job. So that's really what it is. So it would be better to say chronic heart not optimal function. I mean, that would be the ideal term here, but we have this term failure. So of course there's a range of it. Some people have a little bit of it, where they might have a little bit of shortness of breath, a little bit of ankle swelling, both, one or the other. They might feel a little bit fatigued, to all the way to so severe that they can't even get out of bed and they need a transplant. So that's the range of problems with congestive heart failure. So we're talking about, of course, patients who are more, at the beginning stages of this rather than at the end stages.
So I want to interrupt you and
Sure.
add an anecdote about the name congestive heart failure. When I was doing my medical training, one of the cardiologists there was actually at the time the president of the Heart Failure Society of America. And he took that very seriously, that phrase and the negative connotations of it. And he actually was trying very hard within the society to change that name and get rid of it.
Well, I made up one. What was his?
Yeah,
What
his was cardiorenal syndrome or something.
Syndrome.
Yeah, and just make it more scientific sounding, get rid of the failure, the negative connotations. Obviously, he didn't succeed in his efforts.
Yes.
But I think his thought process made sense, because
Sure.
whenever you say it, I get these looks from people right back at me of mortal fear.
Yeah. Well, I've taken on my list of problems that I hand to the patients at each visit, so they know what their history is. I almost never use abbreviations except for this diagnosis. Yeah. I don't put MI, I put myocardial infarction. I don't put HTN. I put hypertension, but I put CHF because it does make people very nervous. So it's very interesting. So how do you live confidently with this? So that's I guess a question. So the article says that for heart patients, confidence can refer to self-assurance, positive and healthy actions, and expectations that they'll have good, healthy outcomes. It's pretty reasonable things. So let's break that down a little bit. So self-assurance. So one of the things is, can I be confident? Can I be assured that by working with my doctor, taking the medicines, following the diet recommendations, getting the testing that's needed, and basically following the recommendations, that I'll lead a good life? I think that we can say yes, largely you can, but it really requires a team effort, because more than any other diagnosis, this one can really be undermined if the patient isn't cooperating and working with us. So I think the self-assurance is really good. And then the positive and healthy actions are those ones I mentioned: taking the medicines, staying very strictly about a low salt diet, and following up with us to make sure you're on track are really critical things. And then what kind of expectations? Well, that depends on what the heart status is and how far along the process you are. But we can give patients a real sense about what's expected and what the frequency of problems might be with the current state of the art.
And I assume a real critical part of this is patient education and understanding and how to monitor their symptoms, the importance of reporting these symptoms. To me, that seems like a critical piece in all this.
It really is, and I'm really excited to hear what you say because they actually have a suggestion of a chart for patients to try to track this, so we'll talk about that a little bit. So disease confidence, as we mentioned, is a greater sense of personal security and empowerment. And Dr. Srivastava said that when he says it to a patient, sometimes they're, go back on their heels about, what does this mean? And so we don't want to take people's hope and confidence away, but it's of course critical. We're responsible for sharing the diagnosis with them, so we can't not tell them. And some people would say, well, don't tell them. Well, that doesn't serve this purpose either. So really, as I mentioned, self-care is a really critical part of it. A lot of these things, a lot of things that we do, blood pressure, cholesterol, for instance, if the patient takes the medicine, there's not much else they need to do. But with congestive heart failure, there is more to do. There's diet issues are more important. Monitoring yourself with weighing yourself and checking for ankle swelling or breathing issues really become a critical part of staying out of trouble.
So what you mentioned diet, so what are some of the dietary issues that a patient with congestive heart failure should adhere to or pay extra attention to?
Well, I think the biggest thing is that one of the things that I'm been concerned about is in the press lately has been some controversy about whether salt is really important for general health. There's a controversy that maybe it's been overdone worrying about salt. And I have to give it to, maybe we have overdone salt in general, but we haven't overdone it for these patients. So congestive heart failure is a huge problem when it comes to salt. And one of the things I try to explain to patients is, and I know I haven't done this well often with my own patients, sometimes my dietary recommendations like watch your diet, cut back on fats, cut back on salts, they hear everything and they think it all has long-term implications. But the problem with this diagnosis is if you have congestive heart failure, if you have a salty meal, if you go out for Chinese food or eat pizza or have too much salt, have chips, you could be in the hospital tonight or tomorrow. I mean, that's how fast it can be a problem.
I say it almost the exact same way to every single person. I'll say, look, if I'm trying to lose weight and one night I slip up and have a cupcake, no big deal, nothing's gonna happen. But if at night I have congestive heart failure, slip up and have potato chips, pizza, I'm in trouble, or soup or something, I'm in trouble. I'm gonna just sop up the fluid, retain the fluid immediately. I see it all the time. People who come back from vacations, cruises, whatnot, and the dietary indiscretion with all the sodium, they end up puffed up like balloons and full of fluid. So I think, yeah, absolutely, a patient education about the diet and how important it is critical in someone's self-management of their disease process.
So in terms of what you were just saying about, how do we help our patients with this? Well, of course, it is an educational process. And of course, you and I, we're limited in our time with patients. What we've tried to do, I know you and I are highly invested in this, is try to figure out ways to get information out. Hence, we're here. Yep. We have this posted on our website, and we have this showing in our communities, trying to get some education out for patients to get little bits of information. At each visit, we try to move the ball forward so that they understand about the critical aspects of medicine. At each visit, I go through each medicine and explain, why you're on this, why I'm pushing it up, what the goals of treatment are. I don't do it all right, but I'm saying that's what we try to do. But I think that we could somehow do better, and I'm hoping that some of the resources that we've developed with these programs and other strategies can help patients who want to learn more to help. So the self-education and knowledge piece of this is really, really important for both doing it right, but also to be more at ease. I mean, if you don't know, I think people are more anxious, more uncertain. A lot of my patients, they'll express an anxiety to me, and I try to say, let's redirect your anxious energy into energy to do the right thing rather than just worry about things, because worrying and doing the wrong things is terrible. If we don't worry and do the right things, we're really much better off.
Sure, absolutely. Now, when I skimmed through this article, the next major heading in here is talking about symptom monitoring. So maybe we can talk a little bit about what the symptoms are with congestive heart failure and how patients should go about monitoring these symptoms and reporting them if necessary or acting upon them.
Sure. Well, so I think the big thing is that the heart is not working optimally. So it's not pumping blood. So the heart and the kidneys aren't getting rid of fluid, so fluid accumulates. And it can accumulate anywhere in the body, but chief places are the ankles, the belly. Sometimes the belly gets bigger and it feels like people are getting fatter, but it's really fluid. Or they get short of breath because the fluid is in the lungs. or overall it's all over the place and they feel more fatigued. I guess those are the big areas of symptoms. So when people have these symptoms, we urge them to seek attention because we often can make minor adjustments in medicine and prevent it from getting worse and having the patient be hospitalized. It's sort of like falling off a cliff, or maybe a better way to think about it is a waterfall. I mean, if you get caught before you go over, it's a lot easier to sort of pull back from the waterfall. But once you go over, we often have to go to the hospital and spend time with intravenous medicines, spend a few days getting the fluid out to get you back to your baseline. So that's really where the sort of symptom monitoring is really critical. We ask patients to weigh themselves. My general approach has been to tell patients if you gain 2 pounds in a day or 5 pounds in a week, that's something that we really need to hear about, because normally if people aren't gorging themselves with food, eating a lot, you don't gain that much weight. So if you're gaining that much weight, it's usually fluid. This article uses 3 pounds in a day. What have you generally used?
As I was about to say, I always say 3.
Okay, you say 3. Okay.
Yeah, 2 or 3.
You're with the data.
Yeah,
so
it's
I'm an outlier. So, so that would be really a key thing. And of course, there are people now who are trying to make a living in the business of congestive heart failure. There are people who are doing home monitoring. There are companies who are contracting with some insurance companies who are doing home monitoring, where a patient will have a scale and a blood pressure cuff at home that measures their heart rate, their blood pressure, and their weight. And this is transmitted to us to see if there's trends, if there's any kind of abnormalities. What is your thought about these, what's called telemonitoring, T-E-L-E monitoring, telemonitoring? Do you find them to be useful? What are your thoughts about them?
Yeah, no, I do. I have had plenty of patients in whom we have picked up before trouble has really declared itself, that they're starting to retain more fluid, being able to intervene proactively, calling them and saying, hey, look, the weight's going up, what's going on? And then they go through their symptoms, and we can very easily adjust the diuretics, even over the phone. Take an extra for a couple days, and we keep getting the data about the weight, and it's been a very nice way to avoid these patients ending up in the hospital. It's also been a way of avoiding the extra hassle and cost for them to come to the office for a visit as frequently. So I have quite a few people in whom it has benefited. There's some in whom I have it where they've just done fine, and it hasn't really served them a purpose, or hasn't been negative though either. To me, I think checking the weight on a daily basis is probably the single most important thing a patient with congestive heart failure can do as a self-monitoring thing. And I just tell everybody, wake up in the morning, go to the bathroom, check your weight. So that way it's apples to apples every day, you're comparing the same thing. Don't check it in the morning one day, in the afternoon another day, and try to compare those two. That doesn't give me as much useful information.
Okay. So let me ask you, I'm going to put you on the spot here, but this table that we have in this article that I've shared with you is something that they're encouraging, these American Heart Association authors have encouraged, that patients have like this system at home whereby they could monitor their own activity. So you say that you're telling them to do one of the things on this list, which is to measure the weight and record it, bathroom, scale, piece of paper, pencil, today's date, the weight, write it down every day, bring that in. That's what I think we're recommending. But beyond that, this article recommends that we ask patients to evaluate, did they take their meds every day? Were they able to exercise for 30 minutes today, or less, or none? Were they able to check their blood pressure? Was it in good range? Were they able to keep their salt level good? And were they able to enjoy their activity without limitation? So do you think this kind of thing would be something that we should do? Because you and I are trying to do the best for our patients.
Yeah.
Would this be cumbersome? Would this be adopted by patients? What are your thoughts on that?
I think, obviously personalities differ and different people do different things. I think some of it I just took for granted, which I shouldn't. The box on here that says take meds. I shouldn't take that for granted, because the fact is, and the reality is, people don't take their medicines nearly as much as we like to think they do.
Right, some report 50 to 80% compliance.
And so that, and whatever you can do to drive home the point that is important. I think it's a great idea. I think, sometimes in people who have blood pressure it's fine all the time, I don't want them also obsessing over checking their blood pressure every day if 30 readings in a row are perfectly fine. I'm not sure they need to check it every day. Okay. But I guess the point of driving home empowerment and self-confidence and managing yourself, it's a great tool, I think, and maybe we should look to adopt something similar to it.
Okay. So the next topic was exactly that in the article, was how are patients doing sticking with their meds? So I had a patient just recently who was on one of the heart failure medicines called lisinopril in combination with a diuretic called hydrochlorothiazide. He went to the pharmacy and the pills were different color. So he said, well, these must be different, so he just didn't take them. So then his ankles were swollen, he's away on vacation, and his family called in a panic, like, what did I do to cause this? And it took us a bit of time to sort of evaluate that he had just stopped this medicine and hadn't told anybody, so he didn't follow the medicine correctly. So these are the kinds of struggles that we have in terms of treatment adherence, knowing, just like we said with the salt, one day can put them out of whack. It's not long after they stop medicines or don't take them faithfully that patients get out of whack. Do you have any other insights in your own practice on how to drive that home?
No, just talking about it every time and all the time and educating the importance of the medications, and I think, yes, I think those are all good, and giving lists of the medications is always important, and reviewing the medications. You run into errors all the time, and especially when someone gets hospitalized, things get changed, they come back to the office. I think it's very important for them to get to the office pretty quickly after a hospitalization, not just if it's for congestive heart failure, but for anything for that matter, because things get changed around in the hospital, and when people get back to the real world and get back to their routine, sometimes the adjustments made in the hospital aren't good.
I've long thought that's a critical thing to do, is to get patients in to review everything after a hospitalization. Things get changed frequently.
And even if it's not heart, I've had a pushback from some people saying, well, they were there for a gallbladder removal. Why are you seeing them again for cardiology? And just this reason. And they pick up on so many things where certain medicines are stopped and they should not have been stopped. And so I think there is benefit to it.
I agree completely with you. So the next subject is a subject that I feel quite uncomfortable about, but it's an important thing, and I certainly want to take good care of my patients and take care of the whole patient, but it's an area that I don't have expertise in, and that's managing the psychological aspects of congestive heart failure, like depression and anxiety. And it's reported that as many as 50% of patients with congestive heart failure have anxiety or depression. Just like you said, most of your patients are anxious the second you give them the diagnosis. So what are your thoughts about this?
I'm probably just as culpable of not being as good or as attentive to this issue, mainly because, out of a lack of expertise. I think it's a real issue. I think it's, in some of the more dramatic episodes of it in my patients, it was easy to pick up on and refer accordingly back to a primary care physician or a psychiatrist to get them some help. But for the less obvious, I probably not quite, and I don't know, I don't have the answer, and maybe just have to incorporate it into your talk with people, that make it a point to ask the question about it. With the coronary disease patients, I've often made it a point to ask men about erectile dysfunction, because they often don't want to bring it up. And try to break down that barrier to talk about it. Maybe I should approach it the same with this, and I don't right now as much as I should probably. Okay. And what are your thoughts about the same?
No, I think that it's one of those things that I've sort of, it is part of my erectile dysfunction is one of the things I do in what's called the review of systems, but I have included depression as it. I'm not sure I do a good job. I say, are you depressed? And that patients will say, I'm sure I do a good job really evaluating that. But it's a reminder to me, and a reminder hopefully to our audience, that they shouldn't feel bad about discussing it with their cardiologist, and just ask for some help if they feel like they're depressed and have things change that are suggestive of depression, like problems with sleep, problems with appetite, problem enjoying things. So I guess those are the big things.
Yeah, there's a lot of well-documented studies looking at depression after bypass surgery. It's a real entity and a real issue, and so it certainly warrants evaluation. What I was and it looks like it's coming up next as you flow through this article about people who have defibrillators implanted, but maybe I'll stop and let you talk about it.
Sure. I'm happy to talk about it, but just to briefly set the stage for our audience, if you have congestive heart failure, and the congestive heart failure is from a very weak heart. Congestive heart failure can be from a variety of reasons. It can be from an excessively strong, stiff heart, or it can be from a weak heart. Half and half actually of those two groups, but there's other causes like valve problems and other problems. But if your heart problem is from a weakened heart, we know that you're at risk for an irregular heart rhythm that can cause sudden cardiac death. And a kind of pacemaker that can be put in the upper chest called a defibrillator that actually will monitor and give a shock to the heart if the heart does misbehave in this regard is a life-saving strategy. So we know that that's something that's available for patients, and living with that confidently is something that we have really improved. And again, you on a prior episode talked about the history of cardiology, and of course this is a major innovation, but I was just thinking the other day about how just in my short career, how the history of this defibrillator has changed. There was a time where we would frequently have patients getting shocks. Sometimes they weren't appropriate shocks. Sometimes they were inappropriate shocks for just the defibrillator just shocked for not a good reason. We almost don't hear about that anymore. It happens rarely. It used to happen every week we were dealing with it. Now it happens a couple times a year, it seems.
Yeah, and right now when it goes off now, it's going off appropriately, and
Right.
it's saving somebody's life. And I think you were going to get to this eventually and talk about the whole point of this conversation, the fear. Some people live in perpetual fear of a defibrillator going off. It's hard to, how do you mitigate that? How do you...
Well, it's one of those things that's tough. I have an electrophysiology friend who gives talks to lay audiences, and he has a big slide that says, "The shock is your friend." It's because if you are being shocked, it means your life was going to end if you didn't get the shock. So I think that, but I don't know sure if that helps allay people's fears, because patients say that it's like getting kicked in the chest by a horse. It's not a comfortable feeling. But I think that the point I made earlier is how we're seeing much less shocks for either good or not good reasons, because the computer algorithms that evaluate shocks are now changed. So there's other ways to get people out of irregular rhythms by using pacing and other kinds of strategies. So the amount of shocks are really significantly less, and patients who are getting shocks are almost always getting them appropriately. And many patients seem to be dealing with it on a better basis, I guess. I feel like it's less often.
A handful of people who, when they're shocked, will say to me, "I never want that to happen again." And they're nervous for a while, but then when they get back to normal life, I guess that abates to some degree, which I guess I can understand, why somebody might be anxious about that. But yes, the driving home the point that it saved your life, I think, helps,
Right.
certainly.
Right, I think that, and we do, just to share with our audience, we do have some ways to tweak the way that the shocks go off. We can make it, the patient go longer before they get a shock, so it reduces the chance of a shock, and we can use more of these other ways to tickle the heart out of the irregular heart rhythm rather than going to a shock. So I guess those are important strategies.
And what does this article or the recommend? You're a chronic heart failure patient with a defibrillator. You get a shock for the first time. How do you handle that? Or you're someone who's had a shock before, you get one, but you feel fine afterwards. What are some of the recommendations on how to handle that?
Yeah, so I think that we're on the same page as what the article suggests for our patients. If you have a shock with the defibrillator and you're a congestive heart failure patient, if after the shock and you sort of get over the shock of being shocked, we generally say that if you feel fine, you don't have any chest pain or lightheadedness or severe shortness of breath after you've sort of settled down, if you have just one shock, you can actually call us the next day and we'll bring you in and evaluate the device and see if any changes need to be made or what the story is.
If it's the first time it's ever happened, do you recommend rushing off to an emergency room?
No. Yeah. If you don't have any of those symptoms.
Right.
If you have any of those symptoms, then yes, you should go to the emergency room. And if you have more than one shock, you should go to the emergency room. But I think if you have one shock and you feel fine, calling us the next day and reevaluating this by using a computer to actually look at why the device went off, what the issues were, and whether we can make adjustments is the best way to go. So I think that, in my mind, there's a lot of resources out there, and try to bringing these resources to patients in terms of strategies to live confident with congestive heart failure, which, as I said at the beginning, is the most common cause for admission to the hospital. But millions of Americans are living with this problem in various forms, from mild to moderate to severe. And these strategies of really collaborating regularly with a cardiologist who goes through these issues, collaborating also with your primary care physician as part of a team to keep you well and keep you out of the hospital is a high motivation for our patients to ultimately reduce costs for the healthcare system. But of course, for an individual patient who doesn't care as much about the healthcare cost system, really cares about sleeping in their own bed, being comfortable, not having a problem that requires emergency intervention is really the key that I think that we can really get to on most patients with really good collaboration.
Yeah, and as we're starting to run short on time a little bit, I guess there's a couple other points I wanted to touch on. One, the role of the family and the need to educate them and empower them and get them involved. And number two, the importance of chronic heart failure patient remaining engaged in their activities that they enjoy. Maybe you can speak to both of those topics.
I think that, that the activities, we want patients to remain active. So one of the things that happens with the anxiety, depression, is that patients sometimes are so limited by those fears is that they don't do exercise. And we know that exercise helps patients improve their exercise capacity. It may not help the heart be stronger, but it helps people deal with a weakened heart by exercise. So just daily walking and being active is really a critical thing. But staying engaged in life with visiting family or keeping your mind active, keeping physically active are really critical things to improve the quality of life for our patients. I tell many of our patients to take a European model for grocery shopping. I say grocery shopping every day. Some of our patients, they just, they don't want to go out of the house. They sort of get shut in. They don't do much. It's not good for your mind. It's not good for your heart. It's not good for your physical strength. So getting out and doing something every day, I tell patients if there's a place you can walk to get the newspaper in the morning rather than having it delivered, are really good strategies to try to remain active and improve a good quality of life. So I think those are things that I think are critical. But again, for many patients with congestive heart failure, adhering to the diet and medication strategies and following these monitoring things we've discussed, like weight and medication adherence and vital sign measurements, are really ways to live confidently with congestive heart failure, the topic of this article and our conversation today.
Great. Any other last, we're really starting to run short on the time here. Any other last bits of advice to the patients that came from this article, or any resources you can point people to online?
I'll leave this to you to sum up and tell us.
I think it was a topic that maybe we as physicians sometimes overlook when we have our 10, 15-minute slot with patients. We're so focused in on, number one, seeing how they're feeling. Number two, making sure the medications are accurate. Number three, figuring out what tests might need to be done or what adjustments might need to be made in the medication, that we sometimes, it's easy to sometimes oversee the importance of empowering a patient to be confident with their disease and how to live comfortably with their disease. But I think it's an incredibly important thing. And so this, maybe we should have this type of article, ready to hand out to our patients so that they can read it when we're in the office with them. But I think it will help a great deal. I think patients will benefit from it and do better with the disease. So thank you for bringing this topic to light. I think our audience will likely enjoy it. And with that, this was another episode of Matters of the Heart. It was brought to you by Pentucket Medical Cardiology, as well as Haverhill Community Television. Thank you for joining us once again.
What do you think about this? What do you think about this thing?
Yeah, I think it's not bad. It's something